Welcome to the Deep Dive. Today we're looking into knee replacement for seniors. We've got a great guide here for patients and families, and our goal is really to pull out the key insights so you can understand the options, what to expect, if you're dealing with chronic knee pain. And let's just jump right in with something that, well, it seems to trip a lot of people up. This idea, this kind of age myth around knee surgery.
Yeah, it really is fascinating how persistent that idea is because the research, it actually tells a very different story. We've got studies now, big ones, showing that people in their 80s, even their 90s, get, well, excellent pain relief and much better mobility after knee replacement.
Excellent relief even into their 90s.
Absolutely. And what's maybe even more surprising is that these older patients often have better long-term outcomes compared to younger folks.
Better. How so?
It's pretty logical when you think about it. Seniors generally put less, heavy stress on their new joints day to day. So the implants, they tend to last longer.
Huh. That really flips the script, doesn't it? So age isn't just not a barrier. It might actually help the implant last longer.
Yeah.
Okay. That's quite an opener. So if someone gets past that age concern, what are the actual surgical paths they might look at?
Well, you've basically got two main options on the table. There's total knee replacement. That's the most common one.
Yep.
It replaces the whole joint surface, ideal if the arthritis is, widespread.
Okay, total replacement.
And then there's partial knee replacement, which, like the name says, only replaces the damaged part. It leaves more of your own healthy bone and ligaments intact.
Right, partial. Is one better than the other?
It depends. There was a big 5-year study, actually. It found that while both give similar pain relief, which is key, the partial knee patients often reported higher satisfaction levels and, interestingly, a faster recovery.
Faster recovery, higher satisfaction.
Yeah.
That sounds pretty appealing for the partial option.
It can be, yeah, for the right candidate.
Now, you hear so much about technology these days. Robotic surgery versus the conventional way. What's the real difference for a patient? Does it matter much?
That's a really common question. So robotic-assisted surgery uses computer guidance, basically a very sophisticated tool to help the surgeon be incredibly precise with bone cuts and implant placement.
More precision.
Exactly. Conventional surgery relies more on the surgeon's direct experience, their feel, using traditional guides and instruments. It's a method with a very long, very successful track record.
Okay, so robot guidance versus surgeon experience.
But here's the crucial point. The current research, and there's quite a bit of it now, shows that both methods generally achieve similar results when you look at pain relief and how well people function long-term.
Similar results, even with the high-tech robot.
Pretty much, yes. While the precision is there with robotics, it doesn't consistently lead to, say, dramatically better outcomes for most elderly patients down the line. The bottom line, your surgeon's experience, their specific skill with either technique, that matters more than just whether a robot is involved.
That's really important to hear. Focus on the surgeon, not just the shiny tool. Okay. What about the implants themselves? These replacement parts, how long do they actually last?
Modern implants are really impressive pieces of engineering. They're designed to last a long time, typically 15 to 20 years, sometimes even longer.
15 to 20 years.
Yeah. And for older patients, we often use cemented implants. This means using a type of bone cement to fix the implant right to the bone, giving immediate stability. It's especially good if someone has, say, osteoporosis or just softer bone quality.
Instant stability, that makes sense.
And the stats are really quite good. About 90% of knee replacements are still going strong after 10 years, and around 80% make it to 20 years. So for many seniors, it's very likely the only knee replacement they'll ever need.
That's incredibly reassuring. One and done, potentially. So think about who should consider this. Who's a good candidate?
Well, the main thing is severe knee pain that really gets in the way of daily life. Things like walking, climbing stairs, maybe it even keeps you up at night.
Pain that impacts function.
Exactly. And it's usually after other things haven't worked well enough, medications, maybe injections, physical therapy. Crucially, you also need to be committed to the rehab afterwards. That's non-negotiable.
Right, physical therapy part.
And people often worry about other health issues like diabetes or heart conditions. Those don't automatically rule you out as long as they're reasonably well managed before the surgery.
Good point. It's about control.
Yeah. And remember, the goal here isn't usually about, running marathons. It's about reducing that constant pain and improving your ability to just do normal, everyday things comfortably.
Getting back to daily life without that nagging pain. Okay. So what does that recovery actually look like, especially for seniors?
It starts fast. Physical therapy often begins the very same day as the surgery.
Same day. Wow.
Yep. Hospital stay is usually short, maybe 1 to 3 days. By about 6 weeks, most seniors are managing basic daily activities pretty independently.
6 weeks for basics.
But, and this is important, the real significant improvements, the big gains in strength and function, they often happen between month 3 and month 6. It keeps getting better for up to half a year, sometimes longer.
3 to 6 months for the major gains.
Exactly.
Yeah.
So consistent physical therapy and, honestly, patience are key. But the improvements in pain and function are usually, well, dramatic, life-changing for many.
So wrapping this up, it really sounds like modern knee replacement offers tremendous hope for seniors struggling with that chronic knee pain.
Absolutely.
You're talking less pain, moving better, sleeping better, just a much better quality of life, really, getting back into things.
Which really raises the point. Don't let your age, just the number, stop you from looking into this. It can genuinely be a life-changing option.
Right. Your golden years, they should be about living comfortably, doing things you enjoy, not just, managing pain.
If we connect this to the bigger picture, it's about having that honest talk. Sit down with an experienced orthopedic surgeon, discuss your specific goals, your worries. Don't put off exploring what a less painful future could look like,